NeuroPsyCad. Precision in neuropsychiatry.
That's right. Good evening, everyone. I'm Diana Prata. We are NeuroPsyCad, and I'm here to tell you about the hidden world of neuropsychiatric diagnosis. So every year, 1 out of 3 people experiences some sort of neuropsychiatric disorder, from depression to Alzheimer. When it is chronic, it is the most frequent and debilitating chronic illness, even over cancer and heart disease. This is Alice. True story. She started feeling forgetful, mentally confused, so she went to the doctors. She spent 6 months waiting for a diagnosis of Alzheimer's. And she spent a considerable amount of money in several kinds of exams. So we ask, how is a neuropsychiatric diagnosis done? I'll tell you. Step 1. The patient comes to the clinic, the clinician evaluates the clinical history, observes the patient, and then makes up, in his mind, a subjective impression of the patient's behavioral symptoms. This impression comes from a subjective impression from the patient also. Step 2. The clinician orders brain scans. Then he looks at them and he searches for small regions, 1 or 2, and compares them to a memorized generic image he has in his mind of what the disease should look like. This, of course, is very difficult. Why? Because, especially at an early stage of an illness, these changes are very subtle. And what are the consequences of this? Well, long time until diagnosis. In Alzheimer's disorder, especially, 1/3 of the cases are misdiagnosed or underdiagnosed. And this, of course, can be very distressing for the patient and families. And above all, this leads to long time until treatment. Why? Because you need a diagnosis if you want to get treated, preferably the correct diagnosis for the correct treatment. So this 1/3 is not being correctly treated or not treated at all. And symptoms get worse, entailing unnecessary costs. Too many appointments and too many exams per patient can amount to huge costs worldwide in misdiagnosis. This scenario is typical of all neuropsychiatric disorders. So what can we do to help? This is our solution. I present to you a service that provides an accurate and early diagnosis of neuropsychiatric disorders, NeuroPsyCad. How do we do this? We introduce a new step, step 3 in the process. The clinicians upload the brain scan into our server. Then we statistically compare it to a database of brain scans from patients. We then look at the whole brain, not just 1 or 2 regions, the whole brain, and connections between areas to detect constellations of subtle changes that are impossible to detect with a human eye. This is much better than the clinicians comparing it to a view in his own head. And if we need different brain scans, like PET or MRI, we can integrate them so that we capitalize on the information. In the end, we'll provide this automated report in hours for an accurate and early diagnosis. Take this case, Alice's case, for example. We found that she had 93% probability of having Alzheimer's. And this was independently confirmed by the clinician later on. We provide a personalized risk score for patient. This is personalized medicine. Benefits, you can tell. Early diagnosis and accurate diagnosis and a fast reporting that we provide leads to early treatment being possible. At the macro level, disease management starts early, disease progression slows down, and system healthcare costs go down. We've talked to several key opinion leaders in the field, clinicians, and they told us that they have been looking for solutions like this for a long time, and that they would use it themselves immediately. And Alice's son was very happy. What about other neuropsychiatric diagnoses, you might ask? Well, we have been developing, apart from Alzheimer's, solutions for Parkinson's, schizophrenia, and autism too. And we've reached really high accuracies, as you can tell, in the 90%. And this is better than clinicians' accuracies, as you can see. The price. We price 300 euros per exam. This is above the current products that are premium at the moment. This represents the added value we bring to the clinician and presents a strong business case for the insurance companies. Our served market is the 1 million new case presentations that happen every year for these 4 illnesses, for suspicion of these 4 illnesses only. But we need less than 1 million euros to start. And we predict that in just 5 years, we'll get to 50 million euros revenue, with a payback in 3 years and really high profit margins. This is a product for neurologists, psychiatrists, and radiologists. So we are ready to start field trials with our partners, key opinion leaders, clinicians, in their private practice, and use European clinical research networks too. Then we'll promote it in private hospitals and with insurance companies for entry in the reimbursement healthcare plans. And then we'll scale up in state hospitals. We just finished our also prototypes for those 4 illnesses. We are ready to start field trials and then launch and get certification so that we can make a strong entry in the European and American market. This is us, NeuroPsyCad, a mix of neuroscientists and biomedical engineers, and now proud COHiTECians. And this is Alice, so our diagnosis was right. Alice could have had her diagnosis on the same day she did a brain scan, all in one day. Worldwide, this could potentially make huge savings in healthcare costs. COHiTEC improving diagnosis in neuropsychiatry. Thank you very much.